that sort of reputation that the treatment had because of the interferon component has made it scary for a lot of people. Some have been through it anyway and have told others about it, and it hadn't necessarily cured those that went through it, and then there's obviously those that really suffered. So that information has sort of spread far and wide, and it's a matter of dispelling that myth for people.
So if somebody's thinking about treatment, I'd tell them a little bit about what the treatment might involve, and typically that's going to be a tablet a day, several tablets a day, sometimes between 8 and up to 24 weeks in some cases of treatment, but usually very well tolerated, usually no significant interactions with other medications they might be taking. A lot of people with hepatitis C have other chronic conditions such as mental health issues or blood pressure or diabetes or metabolic issues, and it's, I think, reassuring to say that by and large the hepatitis C treatments are not going to impact on the treatment they may be on for other important chronic health conditions. So I would really emphasise the drugs are tolerable, that people actually often feel quite well once they start the treatment, because as soon as the level of virus is hugely reduced in the blood, they start feeling more energy or rediscovering energy that they had previously been used to fight the hepatitis C. And I'd also tell them that the cure rate, regardless of genotype at this stage, is at least 90 or 95%. But some of the important things to acknowledge are that hepatitis C treatment works in the vast majority of people who take it, but sometimes it doesn't. Maybe 5 in 100 people do not achieve a cure for one reason or another. And it's really important to acknowledge that for clients up front, so that if they are in that 5%, they're aware that they can re-engage with care, that there can be second treatment options.